But at any rate, so, hey, thank you so much for being here this morning. This is probably the coldest morning of the year. This is, I think, hopefully it will be the coldest morning of the year. We won't see a repeat of this for another few years.
Agreed.
I know, but so I'm very, very glad to see everybody. It's nice that you all come out. I know it takes extra effort in this weather. And we're really fortunate to have Dr. DanTollman with us again, and who always brings fabulous information and about health, and so willing to answer questions. And very grateful that you could be here with us. I mean, it's hard for you too. Next month, somebody sitting at this table turns 100.
Woo-hoo! I'm working on it.
And he's kindly agreed to talk about his life and his work and and his time at the greenhouse. And some of his family might come. So next month Ken will be our guest of honor, and that's I'm really looking forward to that. But sadly, I feel like we need to just take a moment. I know that, I think you all know that George Thompson passed away very suddenly before the holidays, and we're going to miss him.
Yep.
So we keep thinking of Nancy and the family, and that was hard. This was hard.
He was a regular all the time at the men's breakfast for ages.
I can't tell you how much it was.
Yeah.
We've this past year was tough.
Yeah.
Lost a lot of our good friends.
Yeah. Terry Hart
Mary, Arthur,
Yeah.
Joshi, and
Is it possible somebody else?
so that's it. Nobody else is allowed. You all have to. That's why Dan is here.
That's
You
right.
gotta keep us healthy.
Yeah, absolutely. That's why I'm feeding. Oh God.
I like
Then I
that.
go back to work with the stuff all down me. Not even wore an apron. So
What type of candy?
we're gonna turn it to Dan
Pancake do you
and
want?
just get Dan have a few minutes to talk. And
Bring his plate over and we'll
I
put
think
it
it'll be
on.
great. Thank you.
So we've got about 35 minutes till,
Yes.
till the ladies start busting in here.
You got it, Ronnie.
And don't.
It's also delicious, but I tried it on ice cream.
So Colleen, sometimes she has ideas for talks, and sometimes I have ideas and different suggestions, and our discussions kind of go in different places wherever it seems pertinent. This time she thought that it might be a good idea to talk about flu immunization, pneumonia immunization, colds, or kind of over-the-counter treatments of coughs and colds, or falls, how to avoid falls, what contributes to falls, and things like that.
I didn't know that.
Are there any things that are, is there one thing, immunizations, flu, pneumonia, falls, cough, over-the-counter cold remedies, is anything in particularly interesting, or do you want to start with one thing?
Cold weather. Why don't you just without me?
Yeah, hypothermia, cold weather, I don't know what I can do about that. Maybe we should have a meteorologist here next month, I don't know.
I know.
I come every January, don't I, so I always get the cold. Is that planned, or is that just, I should put in a petition to become the June speaker or something. Hopefully the other speakers are
Not much you can do about it, other than try to deal with it.
Yeah, well, and it's interesting with the cold weather, that's one of the things that contributes to having a viral, like a cough and the cold, because the viruses that, the common cold virus lives best in a cooler environment, and that's why it starts in your nose and in your throat. Similar to gout, actually. If gout is a crystal disease, crystal arthropathy, and that's why you get gout on your toes, usually on your great toes classically first, because that's a cooler extremity, and as you know, crystals happen in cooler environments, so it's relatively more unusual to get gout in larger joints. We do see people with gout in knees and elbows and things like that, but usually you'll get it in your great toe first, or early on.
Isn't gout more common in cold weather?
I would think so. I wouldn't I don't know, but I would guess so, because if your whole environment's a little cool. I do have friends that keep their house at the same temperature year round. You know, their house will go from heat to AC just on the same day. Kind of odd. I live with a Germanic person, so our heat and AC are only on about 20% of the year. The rest of the year we're either bundled up or windows open.
You ever get, isn't it in the throat or something, the gout as well, or am I thinking of something else?
Yeah, that would be something else, like a goiter.
Goiter, probably.
Yeah, that's a thyroid nodule or goiters when your thyroid gland isn't working well. With colds and flu, she asked me to talk a little bit about the difference between colds and flus and viruses and pneumonias. If you want to look at the big picture of immunization, you can immunize against viruses or bacteria. You may be able to immunize against other things that are odd, like prions and such, but we won't worry about those. In general, a virus is something that is not really, I wouldn't characterize it as living. It doesn't have, if it's not inside your body, it's not doing any cellular anything. It's not going and finding food, it's not having babies or anything like that. It requires a host to replicate. And what a virus is like a capsule of DNA or RNA, because there are DNA and RNA viruses, and it's covered by a protein, and it entirely is dependent on somebody touching or sneezing or shared fluids or stool or urine or some kind of an exposure, and then it has to find the right animal, the right environment, cold nose, whatever, skin, broken skin, and then it starts replicating within your cells. So a virus replicates within your own cells. That's why it is hard to treat. It's harder to treat viruses, and there are many fewer viral treatments than bacteria. Because viruses, once they're inside your cells, they're kind of like you. It's kind of like fighting cancer. That's why cancer is hard to fight, because it's you. When a virus is in your cell, your body does see that the cell's infected and can do more against it than most cancers, but it's harder to fight. Bacteria, on the other hand, are other organisms. When they're in your body, wherever they are, your body is all jazzed up and says, this is not me, I'm going to go attack it. So there are different, that's why when you have a viral infection, your doctor won't be giving you an antibiotic. Because when we talk about antibiotics, classically we're talking about antibacterial antibiotics. There are antibiotics that fight viruses, antiviral medicines, HIV, hepatitis C, things like that, but those are less common. They do work. Some work better than others, but most common things that you'll go talk to your doctor about aren't going to be common colds and coughs and bronchitis. Bronchitis, you shouldn't be treating bronchitis with antibiotics. Classically, sinusitis, you should wait for a week or two. Many doctors cave in and many patients insist on antibiotics. But as a doctor, that's a problem. The world is becoming exposed to more and more antibiotics, and that's not a good thing.
I'm curious, not that we are in the Ebola kind of area, but do they use antibiotics in that case to fight Ebola, or?
I don't think that they use antibiotics. I think they use supportive measures. Supportive meaning just make sure that they have enough IV fluids, because they hemorrhage and they lose a lot of their fluids and a lot of their blood, and so it's just supportive. I've heard that they're developing Ebola immunization vaccines. So the way that a vaccine works is your white blood cells. There are a variety of different types of white blood cells, and some of them have memories. Once they're exposed to some bacteria or virus, they remember those proteins that they've seen before as bad, and they remember it forever. And so next time you're exposed to that, they duplicate and get jazzed up and put out inflammatory mediators and call the troops to battle. And that's the whole. That's how immunization works, is because you're activating some white blood cells that have a memory. So though the memory, some of those white blood cells in some diseases and some activation create better memory, and the white blood cells memorize it for the rest of your life. Others, like shingles or varicella chickenpox, that's a lifelong immunity to chickenpox once you've had it once. Other things like pneumonia vaccine, the vaccines that we're using, they wane. The immunogenicity, how strong they are, it wanes over time, and it wanes in different people. Different people have different immune responses. If you think about an allergy, people who are allergic are inappropriately hyperactive to something that's out in, like I can walk through a cloud of green pollen and I have no problems. I don't get eczema, I don't have psoriasis, I don't have anything, none of those things. So my immune response is relatively tuned down. Other people who have their immune response tuned up too high, those are autoimmune problems. So allergies, eczema, psoriasis. So it's the similar thing with your own white blood cells. Different people.
Bee stings?
Some people are allergic to bee stings. Yeah, I mean, there are all kinds of allergies, and allergies are somewhat familial too. So you've got families, mom and dad are allergic, and the kids are super allergic to stuff.
Nuts or something like that.
Yep, all different kinds of things.
I get the EpiPen.
Yeah, you've got the EpiPen, so you're more allergic. You've got a good, robust allergic response. So that's the philosophy. So that's what a virus and a bacteria are. Viruses are kind of encapsulated DNA that's floating around the world trying to invade your cells and replicate, and then get out again. Get you to cough on somebody else so that they can go infect somebody else. Or if it's a different kind of like HIV or Hep C, things like that, they're all happy living inside your cells. Hepatitis C, chronic Hep C, they're living in the liver cells and having a good time. Bacteria, there are many bacteria out everywhere. And there are relatively few that infect humans. And so we've got immunization against viruses and bacteria. The flu vaccine is a good vaccine. Every year in China and Southeast Asia, for some reason, the types of flu that we're going to have in the United States begin in China and Southeast Asia. And then they go around the world, westwards, I believe. Yeah, they go westwards. So right now, this season, the CDC is over in China and Southeast Asia and Vietnam and such, and they're looking and seeing what the people there are getting sick of, what kind of influenzas they're getting, and then they're going to create this next year's influenza batch from what's going on over there. So every year it's kind of a crapshoot, and some years they match it better, and some years they don't match it so well. In general, the viruses fall into a few different categories. They're all cousins of each other. So even if they don't match it perfectly, at least you get some immunity. So there is benefit in getting a flu shot, even if you have not a perfect match year. In some years they match it perfectly. It's a bad year in one particular type, and that just happened to be the one that they recommend. There are many different types of flu vaccines also. You've got your intramuscular, you've got subcutaneous under the skin, you've got nasal sprays. Some of the vaccines are inactivated viruses, meaning they're killed. And so they're killed real viruses, and they take parts of the virus and make it so that they're killed viruses. So you might get more of a response to that immunization. Others, they take artificial proteins that the virus would show, and they create those. So those you're not going to have as much side effects and probably not as much immunogenic response. The best vaccines are the ones that are live viruses, attenuated, weakened live viruses. Those are nasal sprays. If there are exclusions. If you're over a certain age and have certain illnesses, you're not supposed to get the nasal spray because they're giving you a weakened virus, a weakened live virus, and that's the best immunogenicity. But there are some, a few risks. You're not going to get the flu, but it's a live virus. They've weakened it so that it only lives in cold environments like your mouth and your throat.
Don't kids tend to use those that you do inhale more so than
Yes,
getting
kids without asthma use the inhaler ones because they hurt less and they work better. And the kids are usually pretty healthy.
Yeah.
The people that have real problems with flu are usually kids under 6 months of age, which you can't give them a shot anyway for this, and older adults and people with chronic illnesses. So they recommend, the CDC recommends that everybody gets immunized, both to protect the people that are at risk, but also herd immunity. If we all have, if everybody in your family and everybody in town were to get the flu shot, even those people that would get flu, because people would still get the flu, it would be less pronounced and less bad, and then they would cough on fewer people, and so it's herd immunity. So that's why physicians really kind of push the vaccines, because we're not only looking out for you, and you may have a hyper response to the vaccine, but for you, we're like, well, see if you can suck it up again, because it's good for you and it's good for everybody. And we think of all of our patient panel, not just one person.
A question.
Mm-hmm.
Probably not all of us, I'll speak for myself. When you go into the operating room, you have to slide over onto the table, it's pretty damn cold.
Uh-huh.
I mean, it's a wake-up call.
Are you from Maine? You said you're from Maine. You're lying, aren't you? You sound like you're from Texas or
So,
Florida.
no. Anyway, the thing is, I asked the doctor and I said, why the hell don't they turn the heat up in here?
Mhm.
And he said, bacteria thrives in heat. Virus thrives in cold. But what they wanna do is the first line of defense in the operating room, when they have you opened up or whatever, is to have it cold. And I said, it's a hell of a way to start off. It's a hell of a way to start off.
That may or may not be true. I have a suspicion that the surgeons who are standing there in their scrubs and then their over thing and their plastic gloves and then their everything are just like, turn the heat down. I'm hot.
Yeah.
I think. I don't know. I can't say that.
Oh,
for
I didn't
sure.
know, all I know is when I hit that steel
Yeah.
table, I said, geez.
Yeah. Your core body temperature, they're not going to let it go down too far.
Yeah.
The difference in your temperature between your nose and your pharynx and your core temperature is probably a few degrees, and doctors will tolerate a temperature up or down fluctuation, a core temperature on the table of a little bit. And they can turn up your core temperature with thermal blankets or cool it down, cooling down the whole room. So I don't know how much there is to that, but there might be something to it. But they give you preoperative antibiotics in general
Yeah.
for the bacteria that are going to be
Well, he
most
said you won't
problematic.
have to worry about this very long. And I
Yeah,
didn't.
exactly.
I mean,
The other
2
thing
minutes
is the
later, I
doctor's
was
gonna
out,
say,
I
hey, you're
didn't
gonna be
know
asleep
jack.
in 20 seconds, you know? Yeah.
Why has the flu vaccine, at least on reports that I've seen on TV, been so ineffective this year and not as effective as it has been in the past? Is it the strain that a new strain that they're not aware of, or?
I think that if you were to do some flu vaccine, statistical research, you would find that the years they kind of wax and wane. You may be hearing and remembering the bad match years or the ineffective years. This year's flu season is just now starting. It's kind of a late year. Flu season is typically October it can go as late as May. We're told to get flu shots starting in kind of, I think, late September, early October, and we can get flu shots the whole time. At a lot of the hospitals, we have to wear a little patch indicating you've gotten your flu shot, and if you haven't gotten a flu shot, you have to wear a mask for the whole year. So the medical world is coming down hard on people who don't want to get flu shots. If you don't want to get a flu shot, you don't necessarily have to be a nurse in this particular hospital. You can go someplace else. That's the feeling, because it's our responsibility to take care of our patients, and that's just kind of part and parcel of the deal. The flu, the flu, you start spreading the flu a day before you start having symptoms. That's the whole crux of the matter. If it were just that all of a sudden, I mean, probably most of us have had the flu to some degree, all of a sudden you're feeling terrible 8 minutes after you were feeling okay. For a day before that, you're shedding virus. If it were just an event where all of a sudden I start coughing and then I go hide myself, isolate myself, that would be a little bit different, because you could at least protect others from you if you did not want to get the flu shot. But as a group, I think it's a good idea. And if you're if you have a lot of allergic or a lot of side effects to the flu shot itself, imagine what would happen if you got the real flu, because that's what these are weakened or chopped up flu. And that's what they're giving you, is weakened or chopped up flu. So if you got the real flu, it would be worse. And that's just kind of, that's my take on things.
Okay, the injection you get then fights the flu that's trying to enter your body?
The injection you get shows the white cells that have a memory, the memory white cells, it shows them it shows them something that they don't like, and it activates them, and they say, what's going on here? So there is something. I mean, it's a little achy,
Yeah.
The flu, it's not comfortable. Some people feel bad the next day, and there's definitely some muscle ache. But that's because they're activating your immune response to some degree, a low degree. And so that way, when you are exposed to the flu, it'll be less. You'll still get the flu, because you're going to get it. But it's going to be much less of a problem for you than if you did not have the flu shot, even if it's a bad match year.
My brother-in-law from Maine the last week or so.
Are you from Maine?
Yes.
Okay, he's actually from Maine. He's a legit Mainer.
All right,
He's a
I wish I was free of that.
He came down very, very sick about a week and a half ago.
Mhm.
So his wife rushed him to the hospital nearby, near Rockland. And anyway, they checked him over and they said, "You really got a bad case of the flu." He says, "I had a flu shot already a few months ago, a couple months ago." And they found out when they checked the flu stuff they gave him, the supply of the flu gave the whole hospital the wrong kind of flu vaccine. Gave him the wrong kind. So they gave him another shot, another type of flu vaccine.
I don't know, the flu vaccine is made every year anew, so there's a whole new set every year. They pitch all the old stuff. There are different types of flu vaccine, and maybe somebody said that one wasn't the right one for you, or I don't know exactly what the situation was, but there are different types of flu
They gave
vaccines.
him something else, some new stuff. He felt much better.
Mhm. Yeah, so, yes, sir.
My daughter had a flu shot about 20 years ago, and she was sick for 2 months. She hasn't had one since, and she's no problem.
Yeah. Some people, they do studies, they do giant studies, they give thousands and thousands of people placebo shots, and there's a similar incidence of feeling sick or feeling bad or having cough. The only thing that I'm aware of that's statistically and all the time more frequent with a flu shot over placebo is the actual ache, the muscle ache, and that's a for sure real thing. So I don't know what to say. I mean, you always hear about the people that have bad flu reaction or bad reactions to the flu shot. Every single medical professional that I work with, everybody around me all day, every day, we all get the flu shot every year. Every single person in the hospital, in every hospital, gets a flu shot. I mean, every single person. I'm sure that there are a few percent. So, you know, in my world, everybody gets the flu shot. So I respect that she doesn't have the flu shot, and she's benefiting from everybody else getting the flu shot. So, you know.
Is diarrhea or anything to do with the flu? I keep coming down with it every year.
You can get a flu, you can definitely have diarrhea with the flu, especially older people. Younger kids can get nausea and diarrhea. Is it younger kids or older kids?
Is it an alternative?
I don't think of it.
He's young.
Yes, you
Doesn't
can.
apply to him.
You can get diarrhea. I think kids can get nausea and older people can get diarrhea from the flu. But generally it's high fever, bad aches, a headache, aches and pains.
How about length of time? Are we talking about days, weeks, before you finally get it?
3 to 10 days, I think is the standard duration. You know, I think that's it.
We're talking about
Of the shot, how long after you have the shot is it effective?
That is a good question. I think it takes about a week to start kicking in, but I think that's what I remember from a talk I gave a year or two ago. So if you went and researched it and you found it was 3 days, I will believe you. Or if you said it was 10 days, I'll believe you too. But I think it's a short period of time. I don't think it's immediate, but I don't think it's a prolonged period of time. Yes, sir.
It seems like you can get the flu shot just about any place now.
Yes.
Is there any benefit to going to a doctor's office versus just any place?
I would get it wherever you can get it, wherever it's convenient. I mean, I get it at whatever place they're giving flu shots when I'm there, and I get it for free because I'm not employed, but I'm a contractor that is in their building a lot. So I get it for free. I think at like CVS and things, they charge you $20, and maybe, you know, places like this, you can get it for free or $20. They try to not make it expensive. They want to keep it at cost. So,
Medical insurance normally covers it. I know it does, ours anyway.
And so is it typically at least given by a nurse where you typically
yes.
get it?
Oh yeah. Nurses are the ones that usually give the shots. Doctors don't usually give shots. We learn how to, but that's not what we do. You know, if you get a
But
doctor,
I
you
mean,
do shot.
I guess the question is, when you're seeing it in so many places, it has to be a registered nurse, or can it be an assistant, or?
Well, there are different kinds of nurses. There are RN nurses, and that's kind of a upper middle, right? And then there's LPN and BSN. They all have different types of experiences, where they have a bachelor's and then they go to nursing school, or they do a 2-year nursing degree, or an associate's degree in the nursing school, or a registered nurse. And then beyond that, you've got master's degree nurses, there are master's degrees in nursing. There are also nurse practitioners, which is a master's degree level, or There are psych nurses, and there are also anesthesia nurses, nurse anesthetists who are master's degree nurses, and you can get a PhD in nursing too. So there are nurses out there that go by Dr. somebody. It's a little unusual. A lot of them will be teaching in nursing schools. So you won't be seeing lots of PhD nurses out there. But yeah, it would be a nurse. It wouldn't be a medical assistant. It wouldn't probably not be a pharmacist. It's not rocket science, so I think you could teach anybody who's kind of average smart. I think you can do it. But I don't know what the regulations are. Probably they're different per state. It's just, you know?
What is your opinion about pneumonia shots?
So pneumonia shots are, pneumonia is a bacteria. There are many different types of bacteria that cause pneumonia. Let me see if I got my pneumonia. And you can get viral pneumonias. So pneumonia just means a pulmonary infection of your lungs. That's the definition of pneumonia, infection of your lung. Strep pneumoniae is the bacteria that causes the pneumonia that we give a shot for. People who are over 65 should get the shot. It says here, let's hear. All adults age 50 or older. No, I'm sorry. All adults age 65 or older should get it. All adults. Age 16 to 64 if you have asthma, diabetes, lung, heart, liver, or alcoholism. If you're a cigarette smoker, you should get it at any age. Residents of long-term or chronic care facilities, so what you guys would call nursing homes, what we call SNFs. And Alaska Natives, American Natives, age 50 to 64. And then you're supposed to get it, a booster every 5 years after age 65. And that's because of the waning immunity. And some people don't need a booster, but you know, we don't know who needs a booster or not. You can check people's immunity, but I don't think it's easy. I think it's easier just to give everybody a shot than to be doing the test for immunity. So I think pneumonia is a bad thing. Pneumonia, the death rate of pneumonia is 5 to 7%, and it says here 1.6 to 2 million people get this particular bacterial type of pneumonia a year. So we have, what do we have, like 550 million in the United States? 2,550,000. It's a small percentage, but it's still, you know, the people who are going to get it are not going to be the young, healthy spring chicken people. It's going to be the people that have chronic diseases, aren't able to walk as well, are more sedentary, older, have chronic medical conditions. So I think it's an easy fix. I think it's a good thing to get. I would recommend it highly.
You hear when elderly people often go in the hospital, if you read through their whatever obituary, they end up dying of pneumonia. So whether they pick that up in the hospital itself, or whether it was something that develops while you're being treated for another ailment.
Yeah, so when you stop walking and breathing deeply, when you're laying in bed, you're at more risk of pneumonia, skin breakdown, urinary tract infections, clots in your legs.
Get up and walk, or jog.
Yeah, so the natural human condition is getting up and about. And so as we all age, we get up and about less. And that's why people who fall, that's why one of my topics was potentially fall. We can talk about it next year. That's why falls are dangerous, because it's not usually the fall itself. I do occasionally see people who are paralyzed from a fall. And it's not even the broken bone. You can be pretty darn sick, and those anesthesia docs and those orthopedic docs, they will fix you up. They'll trade out that thing that you broke. So it's not usually, people don't usually die on the table. It's the recovery period that's really a problem. Because you're not moving. So if you've got bad arthritis and you can't move, or let's say you broke your humerus, your arm, but you used a walker before, so it's not a big deal for me. I could work, but I don't use a walker. So if you're using a walker and you've got a broken arm that you can't put weight on, that's a problem. So then you start accumulating risks, and that's the problem is that if you're immobile, you are at risk for collecting fluid in your lungs, and that's why we'll give you things to breathe in deeply, to take deep breaths. Because when you breathe in deeply, it pulls fluid out of your lungs. So that's one of the theories why people yawn, is that you're collecting a little bit of fluid. You've got a reflex to yawn.
You talking about the nebulizer?
No, it's called an incentive spirometer. So an incentive spirometer is, it's a thing that, it's like a reverse nebulizer. It's let So you breathe in. Well, with a nebulizer you breathe in, but it's giving you medicine in a humidified
My wife
form.
uses them.
Yeah, nebulizers are great.
She's very susceptible to asthma and bronchitis.
Mhm. Yeah. So this incentive spirometer is a round tube thing with a tube on it, and you're supposed to breathe in, and the more you breathe in, it raises the little ball. And it's basically, I tell people if they forget to do that, just every time there's an ad on TV, take a deep breath in and hold it for a second, and that's the same thing. But the better thing is to get up and going. That's why in the rehabs, I tell people that they need to get up and get going as best they can. If you've broken something and you're a tough guy and you don't want to take pain meds, take as much pain meds as it takes to get up and get going, because you're at much greater risk of having a bad outcome from not moving and not participating in PT than you are of getting. People who aren't addicted to Percocet at age 65 or 75 usually are not going to get addicted to Percocet, especially if they have pain. And the Percocet doesn't make you high, it just gets you down to like some pain instead of lots of pain. Those are not the people that are going to have a problem with getting addicted. And that's what most guys your age are going to, they're going to say, I don't want that, I don't want any of that stuff.
You're right. My wife's an RN. You're saying exactly what they've indicated, that right after surgery sometimes, I mentioned about someone goes in for a heart attack, they try to get you out of the bed and get up and walking and being active as quickly as possible. And I guess that's the reason.
Yeah.
How do doctors who are around disease and viruses and all this other stuff, how do they stay healthy?
That is a great question. I very few docs that I know of get sick very often.
Yeah.
I think that there is an element of when you're laying in bed next to someone who's coughing, you've got a way higher exposure. It's all about exposure, time of exposure and amount of exposure. So if you're laying next to someone who's coughing, you're living with somebody that's coughing or has something, you're just exposed a lot more. I'll come and see you for 2, 5, 8, 10 minutes. And that's it. And also, when I'm seeing you, I wash my hands with that alcohol stuff, shake your hand, do whatever I'm going to do, and I walk out and I wash my hands with that alcohol stuff. So it's possible that I'm getting exposed to small amounts, just enough to build up my immunity of certain things.
Oh, okay.
Also, bacteria, even pneumonias and things like that, they're not that, it's not that easy to spread this type of pneumonia. It's not that easy. I don't know. I think also we're just, a younger crowd,
Common cold and homeopathic type stuff. This year my wife got sick and I'm out, someone making elderberry syrup, and I'm out looking for elderberry syrup. We'll cut it in half, Are there any homeopathics that, many of these things I do believe do work. And is the common cold does it lead into other things that you get weakened in that?
The common cold is really a group of like 250 different viruses. So that's why when I say that once you're exposed to one virus, you're immune to it, pretty immune. But the viruses mutate, like internally.
Many times it seems like you get something, you get rid of it, and then it's right back again.
Yeah, and that's usually a different virus.
Yeah,
That's usually a different virus that you caught again. I'm not the best homeopathic doctor to ask questions about because I'm pretty straight-laced, kind of, my wife gets on me, don't take a pill. I'm like, that's my job, giving pills. I mean, what do you mean don't take a pill? So I would say that the things that I think work the best for homeopathic things are remedies, are things that have been studied a little bit. Now, part of the problem with homeopathic remedies is that since they're not, since no particular company owns them, nobody's going to pay for studies unless you've got the federal government, and they're not paying for a lot of things these days anyway. So I think that like zinc and vitamin C pills help with, they're proven to help the collagen. They strengthen the collagen, which is the underlying kind of structural cement that holds your body together. And those help to some degree the throat, from what I've heard. What are those berries that float to the surface when you flood them? Cranberry liquid, well, high dose of cranberries make the interior of the bladder relatively inhospitable to bacteria attaching to it. So I do think that women who have recurrent urinary tract infections, they can take either cranberry liquid or better yet, cranberry pills. I do think that works a bit. Mostly, if it makes you happy, then, and it doesn't hurt you, a doc is gonna bless you. They're gonna say, fine, you do that. Because chances are you're gonna be better in 2 to 10 days anyway. We're gonna always suggest things that, like ibuprofen, which are non-steroidal anti-inflammatories. Those are proven to decrease fever and pain. People don't realize that for sore throat, you can really take ibuprofen and it'll do a good job. Because it's the exact kind of pain that ibuprofen works well with. Ibuprofen is Motrin for the brand name people. Yes.
I was reading an article that said niacin takes down your cholesterol. Is that true?
Yes, that is definitely true. It is true for sure. A lot of people prefer extended release niacin because if you take the high doses of niacin that you need to take, it can cause flushing,
Yeah.
and people don't like that. So they have formulated an extended release niacin that doesn't cause that, but certainly it does the trick. Yeah. For coughs and colds, Tylenol and Motrin work well for the aches and pains and the sore throat. You can take Robitussin DM. Robitussin dextromethorphan is a synthetic cousin of a narcotic, and it decreases your cough response to a degree. I think a lot of it is just placebo in time. Also, Robitussin has guaifenesin, which is an expectorant. It moistens up the mucus, so the coughs that you do have are more productive and more satisfying, or something like that. So, all in all, I don't think that none of them are particularly useful, but I don't think many of them hurt you. So I'm pretty okay with that. One thing that does hurt people is parents of young little kids. Doctors used to recommend that they alternate Tylenol and Motrin for pediatric fevers, but we're finding that more kids are being overdosed on one or the other because the parents forget or don't know how much to give them. So there's actually harm being done. So that's where the doctors are telling people to use one or the other, but not both anymore in little kids.
Does your immune system stay with you your whole life, or does it fade the older you get?
It wanes.
It does.
Bottom line.
So the older you get, the less effective it is?
Well, I mean, when you had either you guys yourselves or family or friends, you probably met people who had asthma when they were younger, and then they kind of just don't have it anymore when they're 60 or 70 or 80. They just kind of grow out of it. Or they grow into COPD and they call it asthma. But emphysema. Or eczema. A lot of people and kids who have eczema when they're younger do not have it when they're older. Rheumatoid arthritis also burns out over time, usually. So, I mean, the joints are all destroyed, but you don't have ongoing damage after a while. So yeah, it does wane.
How important is diet?
It's important.
Very important.
Yeah, I mean, it's everything from too much salt causing, some people are salt sensitive. I think that the statistic I've heard is 10 or 15% of people are salt sensitive. So that means that 10 or 15% of us can really lower our blood pressure if we eat less salt. And the other 85% are, the kidneys just kind of pee it all out. But it's hard to tell who's salt sensitive and who's not, because it's a really hard thing to restrict salt in the modern world. So doctors tell everybody to just eat less salt. At least that's what I tell my wife. That's why I can eat all the salt I want. Because chances are I'm not salt sensitive. Diet.
You don't tell them everything,
Yeah.
right?
Fiber is very important. If you eat a high fiber diet, it helps a lot with maintaining regularity. Getting the bowels moving frequently decreases your risk of diverticulitis, diverticulosis, colon cancer to some degree.
Fish and veggies.
Yeah, well, vegetables have lots of varied vitamins. Fish, fish oils they're good fats and bad fats, and I think that many of the fish oil fats are better for you. But I'm not a dietitian. You guys should actually have those dietitians are super smart. If any of you guys are related to one or know one, those dietitians are smart, super smart. Well, we doctors, doctors, we deal with congestive heart failure and strokes and heart attacks and meds. And we kind of do the whole thing, but when it comes to giving you advice about your diabetic diet or your high cholesterol diet or you should really see because they're specialists. I mean, I'm no specialist. We had some nutrition courses and we keep track of it in general and kind of peripherally. But in truth, in life, you can't have a specialization in everything. So it's a good idea to use the people. If you have a particular interest as a physician in nutrition, you can go to town because you have a lot of good background knowledge. So that's why that's why if your doctor says, I do everything except for gynecology, female exams, or I do everything but I don't do well with diabetes or whatever. if they're not good at that, they know that, they're not particularly interested, respect that, and just go see the endocrinologist or whoever, because they're sending you there for a reason.
One of the reasons that I asked the specific question about diet is that I have a friend who is vegetarian, vegan?
Vegan?
Vegan, yeah. And I'm saying, how can you not like a nice hamburger?
Yeah, I didn't meet any vegetarians until I went to college, so that was a little odd for me as well.
I can't imagine not having a piece of steak or a lousy hamburger with
We're not
a piece of
meat-eaters.
cheese and onion, right? I mean, God almighty.
I haven't ate beef in 40 years. I wouldn't touch a piece of beef.
Really?
I would say
That's right.
for
So
your health.
you are a vegetarian?
No, I'm not a vegetarian.
Oh,
I
okay.
wouldn't touch beef.
He'll eat
Oh,
squirrels
alright.
and
Oh,
rabbits
okay.
and
I have
Chicken?
a brother
deer.
that died
Turkey.
of Creutzfeldt-Jakob syndrome.
Okay, so chicken and stuff like that?
Creutzfeldt-Jakob syndrome.
Creutzfeldt-Jakob, yeah.
Oh,
Yeah,
okay.
I
that's
have
a
brother
prion
died
disease.
Is that from beef?
Oh,
from beef.
I think that you have to eat the beef brain or central nervous system,
No.
right? Isn't that what it is?
The sheep brain is
And they
fed
feed it to the
animals,
beef, right.
cows,
Ah, okay.
and it's transferred.
oh.
Came out of Algeria back.
I
When
think
the
they're
French-
pretty good at keeping that out of the food chain these days,
Wow.
but I could be mistaken. So if you had to say, would it be better to be a big beef eater or a vegan? I would say probably you'll do better as a vegan.
Yeah.
In the United States, we eat way too much meats of all sorts, especially beef, and pork would probably be in there.
You
They say
can't
man is
really-
not a meat eater, you don't have the teeth of a meat eater. Dog, you know, big teeth, they make
You just don't go overboard in any one direction.
Well, what we die of in the United States is coronary artery disease more than protein malnutrition, I have to say.
Yeah.
So, you know, you're putting yourself more at risk of going to town. And my wife makes a lot of beef, so, you know, but I mean, just in general, it'd be better for all of us to eat way less beef, for sure. I think that I've heard, again, you should talk to the nutritionist, but if you take a plain deck of cards, of beef, like if you were to eat 3 times a week that much of any meat, you would get enough protein with a regular diet. Now that's an astronomically small amount for probably all of us, with like the sausages we just ate. So it's a small amount that your body needs. Because your body recycles protein. It doesn't. We don't need lots and lots of protein. It's like men. Men should not be taking iron. Men should not take iron supplements unless you have. For a period of time, you can take it if you have blood loss, like you're on, or colon cancer. If you're constantly losing blood out of your colon because you got colon cancer, yeah, take iron. But men don't have a way of getting rid of iron, other than blood loss. So if you're not losing blood, you shouldn't take iron, because over time it'll become toxic for your liver. Years and years, not.
This is, I don't know how to explain it, regularity. Whether you take stool softeners or whatever, most of them say on the bottom, I take pericolase occasionally, you shouldn't continue it for a longer period of time other than, a week, 10 days or so.
Right. I would say that the best laxative is probably Miralax. Miralax is a non-absorbed sugar. So you eat it and it stays in your intestines, and then what it does is it goes down and it sucks fluid in towards it, and it bolts up your stool, and it causes bowel movements. You can take that forever, and it's not going to cause you problems. What you're referring to are the stimulant laxatives. There are laxatives that are much more powerful than Miralax, like milk of magnesia and mag citrate and things like that. And those are stimulant. They go down there and they irritate the colon, and you go to the bathroom. And sometimes that's what you need. And you can use those. But
How
you should
often
use them all
can
the
you take the
time.
Miralax? I mean, is
You
that
can
a
take it every
regular-
single day if you need. Yeah. I would say, and another thing to remember is that colase is not a laxative. Colase is a stool softener. Colase is an emollient. It makes the whole thing kind of emollient. What's it called? You know how when you pour oil in water, it separates?
Yeah.
Emollients make the water and the oil mix together. So that's what it is. It's an emollient, so that it makes the whole entire mass softer, but it's not a laxative. So
Raisin bran, I think, looks good.
I had a patient once. Let me tell you a constipation story. I was a primary care doctor in Essex, Mass, and I was working the evening shift on a Thursday night, and I got a call from a patient of mine who had been to the dentist and he had been prescribed Percocet or something for pain, and he was super constipated, super constipated. He called me about 5 o'clock at night before I was in between my afternoon shift and my evening patients, because everybody would do one evening, and Thursday was mine. And he said he felt really bad. He was super constipated, hadn't gone for days and days and days, and he was in pain, and he had talked to his he was renting a room or something to a nurse, and she had said, go see your doctor, and he didn't want to, and he was trying all kinds of unorthodox things to get things going. And while he was on the phone with me, he said, Dr. Tollman, I don't feel very good, and he passed out on the phone with me. So this is 15 years ago, or 10 or something. So I hung up, or I said, Mr. Smith, or whatever his name was, Mr. Smith, no answer. So then I hung up, called 911 and said, hey, can you trace this call to whoever? And they said, no, we can't do that. So I had to, because this was back in the day. So I had to run out. I ran to the chart room and, in the old days, all the charts, found the chart. Mr. Smith called 911, sent him to the place, and okay, that was fine. So then later that evening, 8 o'clock, when it was getting to be close to closing time, I was, hadn't been called about Mr. Smith because I was sure that I would get a call from the ER telling me something. And he lived closest to Addison Gilbert in Gloucester. And we used to go to Addison Gilbert and see our own patients there. So I was either going to go home or go to Addison Gilbert, and I just wanted to see what's going on. So I called in the ED, and they said, yep, he's still here. And so at 9 o'clock when it was closing time, I went, fine, I'm going to go to Addison Gilbert. So I went to Addison Gilbert. And he was there, and his blood pressure was like 70/10. And they had just gotten this new ultrasound machine, and they had done an abdominal ultrasound with the wand in the ED, and they said, this guy, he ruptured an aortic aneurysm, and they were bringing in the helicopter to take him out, because they need 2 vascular surgeons to fix that. And so he ended up not making it. And I attribute that to not paying attention to being super constipated on Percocet with an aneurysm and bearing down too hard. So I have respect for that whole thing. And I've had people admitted who are super constipated to the hospital. People do get diarrhea, and it's usually infectious, or other syndromes, but don't poo-poo. The whole, the bowel movements, you gotta pay attention to stuff.
Little play on words.
So we'll call it a day at that, because I think it's wrapping up. It's almost 11 here.
I didn't good.
What's
I'm
that
going to
about?
stick my head out of the.
But that's a true story, even not the poo-poo part, but that is a true story. I felt bad.
Excellent.
So, that's right.
Thank
Proof.
you very very much. Thank you.
Thanks for listening to my silly story or something.